essentially what we're doing is using best-in-class technology to give everyone, everywhere, anytime, the personalized tools to better manage their health condition. And while we're doing that, we're also uncovering a large number of Americans that are at risk of developing a chronic condition and otherwise might not know it. And we find this to be such an important tool for so many people because of the gaps in healthcare. We find that a large number of people who need to engage healthcare don't, because they don't have equitable access. They have a hard time taking the necessary time off of work, or they just aren't aware of their own personal health condition. And so they literally click on a link, and from there, they're engaged in a screener where we better understand their personal health conditions, and then we can triage them into the appropriate level of personalized coaching. And so it's really the ease of access and the personalized insights that allow us to reach a much broader audience and help people improve their health. So Lark is really intended to serve members in between doctor appointments. And so the idea being that when you see a doctor once a year, once every 6 months, you aren't walking away with a clear understanding of your own personal health objectives. And so the idea is that Lark is with you every day to help educate you on areas where you can improve and maximize your health. They're engaged in a screener where we better understand their personal health conditions, and then we can triage them into the appropriate level of personalized coaching. And so it's really the ease of access and the personalized insights that allow us to reach a much broader audience. Yeah, so every one of our members receives a cellular connected scale so we can track every member's weight loss journey. We've also found that our studies show that our average participant is losing over 5% of their BMI, which lessens their likelihood of developing a chronic disease by over 62%. When we talk about our biggest successes at Lark, I think we initially point to the fact that we've put more people through the CDC screener than anybody else in the country. So a tremendous amount of work helping people identify that they're at risk of developing diabetes. We've also achieved the highest level of recognition from the CDC as providing outcomes on par, if not improved, from human-based care solutions. We are the world's first and only digital healthcare provider to achieve an actual NPI number, which I think also shows our clinical effectiveness. Our members in our diabetes care program are showing meaningful drops in A1C, and our hypertension members who also have a blood pressure cuff are showing significant reductions in their blood pressure. Very early on, our company was looking at different ways to appropriately communicate with folks. And what we found is that people didn't respond to fear, and they also didn't respond long-term to incentives. It was very short and fleeting engagement. But what we found is that people were more likely to engage long-term and create lasting behavior change if they were addressed in a very compassionate manner, right? Hey, this was a good meal. We noticed you ate a lot of starches and sugars. We would recommend that we incorporate some more leafy greens. And we found that this is the way to really engage members and keep them engaged. And our utilization and engagement numbers over time, which are well above the industry average, really emphasize that message, is that people enjoy compassionate communication. And I think that's what's made what we do so much better, is that we are engaging people in real time. We're speaking to them as loved ones or family. And at the same time, we're providing very impactful lifestyle coaching so that they have the tools and education to lead healthier lives.